Welcome to the Dan Show. I'm your host Mornay, bringing you the best in dive safety tips and so much more. In this week's episode, we're going to be talking to Dr. Franz about hazardous marine life and things we should be looking out for and how we can maybe sort of prevent them if possible. So this is a good time to kick back, relax, and enjoy the show. Welcome, Dr. Franz.
Hey Mornay, good to be back.
Yeah, nice to have you back on the show as always. So, hazardous marine life, something that unavoidable, I guess, sometimes when diving, because you always have marine life around. Obviously, when you're going to the coastal kind of or sea kind of dives and things like that. And I must say, via the hotline, quite a lot of the calls and sometimes email queries we get would be about hazardous marine life, you know, how to treat it, if it happens, are there any concerns? And I mean, if I just think about it, there's most probably jellyfish, blue bottle stings, all those kind of general things, sea urchins, you know, getting, the needle stuck in spines and all that. I guess even, you know, after dive, you're enjoying some time in the rock pools and stuff, slip and fall, scrape yourself. So all those kind of factors are there, and I guess when you're dealing with the ocean, there are all sorts of goony-goo-goos out there, I guess, that can cause harm.
That's right.
Yeah.
Well, there are detailed articles and a lot of information about this, which we'd like to refer you to. But just to really keep it simple, about 2% of injuries involve hazardous marine life. Okay. Now, you can get poisonous freshwater life like catfish as well, so it's not exclusive to the ocean or the sea environment, but it's more typical.
Yeah.
And we essentially have 4 mechanisms of injury. So you get actual injury, you then get allergy, you get poisons or toxicity, and you can get infection. So those are the 4 broad categories of things that can happen. Yeah. And depending on which they are, you would treat the immediate problem, bleeding, allergic response, a poisonous response, or an infective response. You would treat those primarily. Yeah. And then sometimes there may be complications or side effects, so there'd be secondary issues to deal with. Yeah. But it's helpful just from a first aid perspective that the priorities start off with ABCs. So don't, just because it's a sea urchin or because it's a stingray, forget your basic principles of first aid CPR. It's ABCs. Okay. Then we look at the injury, allergy, toxicity or infection. Yeah. And then depending on what it is, you may have some specialized responses. So, and there are ways to categorize the different ones that you've mentioned just to make it more memorable.
Oh, okay. And I mean, thinking about stingers, I guess.
So the way I teach it is to use mnemonics. I like mnemonics because it helps me remember them. Yeah. But you basically have the snappers. So those are the creatures with teeth.
The biting stuff.
That's right, the biting stuff. All right. Then you have the stickers, which have barbs. Okay. You've got the stingers that have specialized stinging cells, like jellyfish that you mentioned. You've got scrapers, which is any rough surface, or in fact even specialized spines like surgeonfish, that sort of thing that can cause an abrasion or a cut. Okay. You've got shockers like the electric rays, and well, I was quite desperate to keep the mnemonic, so the snackers, in other words, the things you eat that are poisonous, like mussels or pufferfish, that sort of thing. So within those categories, then your approach in a first aid situation would vary. Yeah. So with the snappers, because they've got teeth, the first priority is bleeding, blood loss. So that's your focus. With the stickers, the barb causes pain and poison. So you're dealing with the pain and poison, and usually heat is the emphasis there. Okay. So hot packs. With the stingers, the specialized cells, you want to neutralize the venom, and vinegar is usually the priority there. Okay. For the scrapers, there may be blood loss, but usually it's pain and ultimately infection. So it's just good wound care that you focus on there. The shockers, well, it's over pretty much when you identify it. So unless the person loses consciousness or, you know, has a near drowning event, it's usually a non-issue. Just don't do it again. Type of thing. And then the snackers, if you eat something that's poisonous, it's essentially how long ago did you eat it? Because vomiting is fine if it's, you know, at the point where you can still eliminate it and the person's still conscious. Otherwise, you need to deal with it in life support. So that's a real fish-eye, you know, sort of overview on the topic. But I'd like to refer people to the detailed YouTube materials, articles that are on Alert Diver. Make sure it's only 2% of diving injuries, but you need to know what to do, and especially so that people don't panic, that you can deal with the issue and that you can be sensible and have a basic approach that serves you well. And of course, Dan has training that also teaches this specifically.
Yeah, absolutely. I mean, there's loads of content, and you'll find it down in the show links as well. But yeah, training, very important thing you mentioned there. And I don't know how many people or divers actually know that Dan has developed specific diver first aid training courses, and one in fact is the Hazardous Marine Life Injuries course, and in many ways it addresses a lot of the things that you would learn in a general first aid course, because that's what Dr. Franz mentioned now. But we do go in how to remove the stingers and the cells and some of the barbs, and then even with the food poisoning part that you spoke of, you know, what to look out for, how to assist that person that may be feeling sick, or even yourself. So it's a very nice course. If you want to know more, just get in touch with us. Easy enough to let you know what it all entails. But you know, I guess with Hazardous Marine Life, it goes without saying you need a good first aid kit, isn't that so?
You need a good first aid kit, and specifically you need access to hot packs, hot water. That's a very big piece, and it's not always available. And the other thing is vinegar, which is not always available. And you need relatively specialized blood stopping equipment, whether that's bandages or even tourniquets. So those are unique aspects that may not always be in a regular first aid kit. So one needs to make sure that you have those available.
Yeah, you know, with the first aid kit and all that stuff, we've got a variety of them available. In fact, I brought one along today. It's one of the bigger first aid kits we have, very similar to the smaller one. Comes in a really nice waterproof case. Durable, absolutely. Can take a bang and you know, still last. Any case, inside we got nice packaging with all the bits and pieces, and definitely the hot and the cold pack. You know, so it's really great to help somebody with that. Also, interesting thing is called the SAM splint. You know, it's like a splint that you can manipulate. You know, it's not hard. You bend it and you know, tape it up.
And part of dealing with hazardous marine life injuries is keeping the limbs still. And unfortunately, people really want to keep still. So sometimes using a splint is the best way to remind them not to move a limb. So it doesn't need to be fractured to be immobilized. So, you know, splints is sometimes useful even for psychological reasons, to keep it quiet and to remind the person to keep it still.
And possibly the bystander.
Absolutely.
Well, you know, the hot pack, interesting enough, once again, some story from my Mozambique days. I had a guy who was diving roughly about 25 odd meters, viewing manta rays, awesome dive. It was just one of those days where the water was crystal clear. We had manta rays, we had bull rays, and even whale sharks. You know, it was just great.
Oh, goodness.
In any case, there was a bit of surge and a slight current, and as you know, the lionfish, they always love hanging around divers. So this guy got between the diver and the reef, and as the surge and current kind of pushed the guy, he squeezed up against it and you know, got zapped on the arm. So a lot of pain, and the trip back from the specific reef to the beach was roughly about 20 odd minutes. And I must be honest, my first aid kit in the boat didn't have a hot pack, so the guy was in severe pain. When we got back to the beach, you know, fortunately it was like a type of a kiosk restaurant set up, so they had hot water and all that. But the problem was that the people thought they were going to sort of provide assistance, while I quickly went to go find the proper first aid kit and brought boiling water almost. So then that, you know,
it's good you mentioned that.
Yeah, the guys kind of get that mixed up. They want to use really hot water as opposed to just like warm water, I guess. You know, and that's where the hot pack can resolve that problem.
I'm very glad you lifted that out, because what we mean by hot is essentially 45 to 50 degrees centigrade. And what happens in practice is that the pain prompts the person to put their arm or limb or whatever in the hot water or using the hot pack until the pain related to the sting is less than the discomfort related to the pack.
I see.
So it's sort of pack on, and pack off, you know, and pack on, you know, sort of a 15 minutes on, 5 minutes off, 15 minutes on, and it's usually about 4 cycles, and then it settles. So I would recommend in general that you should have about 4 packs, because they last probably about 20 minutes, and then you'd need to swap out for something else. So I would suggest that people have at least 4, you know, to treat one individual with a bad sting, or at least as long as it would take from the place where the injury occurs to where you can get more hot water. But thank you, yes, don't use boiling water. And the other thing that sometimes happens is people anesthetize, you know, they get local anesthetic and they basically numb the whole arm and then put it in hot water. And that's a recipe to boil the skin off. So, you know, one needs to be sensible, but with basics and common sense, one can get far.
Well, you know, the great thing is that we got so many wonderful resources available via the YouTube channel we have, the website, and we got great new sort of safety tip guides and all sorts of things. So if that doesn't tickle your fancy, you know, just give us a buzz or pop us an email. We'll definitely be able to assist. So that kind of wraps it up for this week. I don't really have much more to say until the next time. Dr. Franz, any parting thoughts?
Actually, I'd like to ask people that if you get stung or you have a weird rash or something, don't you want to send it to us to the hotline, you know, Mornay? Because we'd really like to start assembling a collection of these pictures. Obviously, it might be interesting to you to find out what it was that happened to you, but it really helps us also in training to have examples. Obviously, don't have identifying pictures, you know, just an arm or a leg is enough, but it will help us also when we train. To allow people to be more familiar with what it looks like and to be educated in how to respond to it.
Well, you know, that just before we go, guys, it kind of makes me think that we can use those images for our Dan medics. Absolutely. Even, you know, so you get a call, they've got this kind of library of images to view before they give advice or pass it on to the doctors. I mean, that would be awesome. So yeah, if you guys can help with that, it would be great. Also, if you enjoy this video on YouTube, give us a thumbs up. That would be great. Show links at the bottom, don't forget. And you can always subscribe. That would be wonderful. In any case, that wraps it up. Thank you for watching The Dan Show. Until next time. Cheers.